A very good evening from India and good morning from Canada. We have a special guest today, Dr. Arun Garg, especially for this podcast, and he's an award-winning. He's come from a medical background. He's a pathologist. I can't keep talking about him as a. He has a very unique understanding of how medicine works, and Ayurveda is something he has keen interest in, and he has studied a lot about yoga and Ayurveda. And today we want to bring the East and the West together so that we understand the beauty of both the worlds and how together they can help us, especially women, because right now I work with a lot of women and I have realized that a lot of people a lot of women have these questions on what is Ayurveda? Is it relevant? Is it still relevant though it's too old? Should I trust someone or should I not trust someone? And I've realized that a lot of people in India and abroad, everywhere, they tend to believe in a lot of these medicines and they want to just pop in pills without understanding the effects of it. So, Dr. Arun, I would like to hear from you, like, what is your take on this and where do you see the world also?
Wonderful, wonderful. First of all, namaskaram from Canada. I'm so happy to be with you, Priyanka ji. I cannot express how my body feels. Every pore of my body is excited that I am with you, sharing this common passion and the vision of making society healthy. We both, in our own way, contributing for better health. And what's common in both of us is our heritage. You live in Bharat, which is India. I was born in Bharat, but I left India 1965. That I want to share with our viewers and listeners how real Bharat is and how real Bharat heritage is. So, what we're really talking about is the wisdom which has evolved over 12,000 years, the science, the art of health. And let me start by saying I am a medical doctor. I have a PhD in biochemistry, so I've been very rigorous scientific training. Then I went in medical school, did my medical degree. Then I did my fellowship in biochemical medicine. And then I practiced for 40 years in a very scientific, rigorous Western medicine. But 15 years ago, I had a reconnection with India, where I realized that we have a problem, as they say in Houston. NASA guys up in space. Houston, we have a problem. And I think what I want to tell your listeners and your viewers, friends, we have a problem. India and Bharatiya people have a very high preponderance of chronic diseases, diabetes, hypertension, chronic renal disease. And Priyanka ji, with our heritage and with our knowledge, we can reduce that. I'm not saying we can eliminate it. I'm not saying it will disappear. But what I'm saying is we can reduce it if we pay attention to our heritage and we pay attention to who we are. And I think that's the topic you want to bring. What is the evidence that this knowledge, that wisdom, and different people call it differently, and I'll address that, can work in the modern 2025 and combine with the best of the West, which is physical science. So, really, what we are talking about is mixing, bringing the fusion of the best of the East and best of the West. It's not one or the other. And the real kernel here is that during this long journey of India or Bharat, there have been a lot of doubts raised, and a lot of people have started to play in this field, which is not quite there. And that has created the doubt in our people's mind. And both practices are very different, first of all. As a practitioner of both of them, I could say it's like day and night. So it's not like you're mixing two different types of apples or two different types of oranges. You're really bringing apple and orange together and creating the best Slurpee. So that's very difficult. So just as a comparison, um, Western science is very reductive, and they went through deeper and deeper, but in a focused, more reductive way, a smaller thing. So they started to study physical body, the body which is manifests itself in yogic science, what we see, and they studied the cells. So over the last 300 years, this is only about 500 years old science, and most of the work is really in last 100 years. But they have done a fabulous job in understanding the physical body, what you and I feel, what we live, and they have gone into physical body with the systems, with the organs and the cells. And as a practitioner of biochemical medicine, I could discuss this for ad nauseum, the DNA, the understanding of DNA, how atoms work. But when you look at it, that's great, and we need it, and that is not substitute. So when you need a physical element treatment, there is no substitute to use this science in the appropriate manner. So if you have a blockage of coronary artery, one of very good treatment is get rid of that blockage. We can examine it, we can reduce it, done. However, what it doesn't address is you as a person.
Okay.
It gone into that reduction, so it looks after that little cell which is not functioning, but it leaves you out.
Correct.
And this is where 12,000-year-old Indus Valley Vedic yogic science comes in. Ayurveda is a very small part of it. And that's another confusion, the difference between Ayurveda and all other Vedic knowledge and yogic science. So my take is the Vedic yogic science, which is the foundation. And that's what needs to be. And the big difference between Western science and Vedic science is that Western physical medicine reduces you to a subset of organs. I am a cardiologist, I look after your cardiology. I'm a heart guy. I'm a liver guy, I look after your liver. I really don't know, and I don't have time for you and me to interact as a person to person. Whereas yogic Vedic science fundamentally says you as a person is most important to me. And you as a person and I are going to interact. And the huge difference is that Western medicine is what I call passive external intervention. And what I mean by that is you go to the doctor does something to you, and you are a passive passenger. You're not involved. He or she knows everything, wants to do, and you say thank you. And the other thing is, because the science has gone so far that the outcomes are instantaneous. So you get instant gratification. Most of it is very rapidly acting. You have pain, you want to get rid of the pain, you take the pill, you're done. But so it's very important, and it's very sexy, and I think it's very effective. And I've been a practitioner of it for 40 years, and I would not do without it. If you have high blood pressure, sometimes you have to take those high blood pressure medications.
Correct.
So right up the front, let me say, first of all, that what we are talking about is a conversation and guidelines. It's no substitute for a person to see whoever their practitioner is. And that advice should come from them. This is general discussion.
Correct.
So that's the physical medicine. The Ayurveda and greater extent yogic science says, I want to consider you as a person. Who are you? What are you? And that is what I call internal active intervention. The other one was external passive intervention.
Mhm.
This is internal, comes from within, and it's active. So you started out your conversation that people are reluctant. The reason they're reluctant is because they don't know who they are. They are not connected with their own inner self. So first and foremost is they need to connect with themselves that I want to be healthy. The other one is you had a pain and you have a diabetes. Let's take this pill and I'll be fixed. What I'm saying is you need that, but even
Right.
better is to prevent it,
Yeah.
to live a healthy life, to have a promotion, to delay these things, to have a quality of life, and be empowered. So my three E's are empowerment, education, and engagement. And I think this is what you're doing, and this is what we are doing through this conversation, that we are engaging people who ever bothered to listen from a woman's health perspective and then educate them with some facts and science. By the way, both are deep scientific. And
Correct.
what we mean by science is organization of the facts,
Mm.
knowledge, and turning that into wisdom. That's what science is. A study of the facts, turning them into understandable knowledge, turning knowledge into wisdom is what science is all about. And I would say both Western medicine and our Eastern, and I will limit, and my emphasis will be the word yogic rather than Ayurveda. Ayurveda is a subset of yogic science,
Correct.
because Ayurveda is more intervention and more doing something and has a lot of external, you take something,
Mm.
whereas yoga, first and foremost, is gives you the empowerment of who you are, self-realization, self-awareness, and that is the key. And once you have that self-awareness and self-realization, all the doubts disappear. And then you go in it. You shouldn't go in it unless you have done that self-realization and you want to do it. It's not something that somebody can force on you. Even in our wisdom books, what we call scriptures,
Mm.
I find the two books stand out. One is Bhagavad Gita, another is Patanjali's Yoga Shastra.
Yeah, yeah.
These two are best textbook of medicine from me. They're the
Sure.
best textbooks of psychology. They're the best textbook understanding human nature. And even there, Bhagavan Krishna says to Arjun, Arjun, I have laid out everything for you in the last chapter, but it's up to you to decide whether you want to do it or not. So I think that's my second message, that this conversation is for people to grasp what it's all about, but it's up to them. They take it, fine. They don't take it, fine. Take one piece of it, don't take the other piece. So, because otherwise we try to force people. That's no good.
Yeah.
And so I think
Perfect.
my second response to your inquiry is that it is real. There is a lot of science, but it's different. And in some ways, you could say for women's health, we need both, because depending on what aspect we are talking about of women's health. And there are certain pieces of women's health which are absolutely needed through Western science. For example, screening for cancer.
Mm.
Our women folks are reluctant to get screened because of stigma. Will find out cervical cancer, breast cancer. That's Western medicine, and there is no substitute.
Mm.
There is no Ayurveda or yogic science saying, yes, I diagnose this. That has to be done through that. But before you go there, you need to be of the mindset, I want to be healthy. I
Yeah.
want to live healthy life. And this is where yogic science and Ayurveda comes.
Correct.
Hope that kind of sets the scene for our conversation.
Totally, totally. I totally agree with you because, see, as we also, I was reading about in the book also that there's a book called Heal Yourself. We always forget And as a science, also every day it's also evolving. We are also as human evolving, but we always forget to understand who we are totally. We try to find quick fixes, which we understand because we are in a very busy world where we are trying to achieve a lot of things in our life, which is not bad, it's good, but we are not trying to understand what's going inside us.
Yeah,
And
exactly.
yoga helps you in holistic approach in understanding each part of you, your emotional body. We actually differentiate it, understand emotional is something else and physical is something else, but it's all together. There are different koshas, as we say in yoga, and all of them are in you. And this is how you then go deeper. And spirituality is also a part of you. But we don't tend to go on those layers. We tend to just fix it. As you said that the medical science wants to intervene in those particular organs or particular parts, but holistically, what we need to work on is what, and therefore we see these challenges now. Younger women are getting very early now; their menstruation is starting, and now there are a lot of complications which are coming up in pregnancy. So I'll start with a very important question: is you have been in medical career for I don't know like 40, 50 years now, and how have you seen women's health evolve, and what areas still remains still we still need, and it hasn't got that attention. So what is that
Yeah.
area you feel that?
Yeah, absolutely. But Priyanka ji, with your permission, can we park that question? But because there is one question we haven't answered, and I think your listeners might benefit from it.
Sorry.
Why I am saying with so much certainty that we need both, and what is the science behind yogic science that I say is science? That understanding. How does yoga tools works? So yoga, as I started out with, is based on long history of studies by rishis, and their focus was understanding how human body works. But then in that journey, they clearly identified with different levels of bodies. And I think a lot of people don't appreciate that. So Western medicine focuses itself on physical body, what is manifested. Whereas yogic science says, beside physical body, we have several other energy influences, and they call it koshas.
Right.
And uh, there are different layers of those, which are as important as your physical body. So, physical body is just the manifestation.
Correct.
And the other thing is because we are made up of the five elements, water, earth, and air, and fire, and space, and they are made up of atoms and molecules. So that's all come together. So when you look at the physical body, even at the end of the day, it is just the sum of all those atoms vibrating. And I think this rishis were able to visualize that, and they say that behind the physical body, there is a very active vibrations of energy taking place. And that is the key for us to understand that energy and sync with that energy. And so we have philosophy of yoga, we have principles of yoga, and we have practice of yoga. And the practice of yoga with the Patanjali codified in 8 tools is very deep understanding of how to understand how that body, different bodies work, and how those vibrations work, and sync that fusion of those vibrations with the physical body. And that is the beauty of yogic science. And more, I think, under our current Prime Minister in India, this whole yogic science has taken a different flavor, which I'm so happy about. And I think more and more research can go into that aspect. And what happens is that when you fuse those vibrations with the real physical body, and modern science is finding out more and more that gut is related to your brain, heart is related to your brain, they still don't understand the mind. There is a huge difference between brain and mind,
Correct.
and buddhi and
Buddhi and
wisdom,
yeah.
vikas and vivek, all those things don't exist in Western medicine. And I think so. for today's purposes, let's just say that there is a good science. There are two different things, and uh, and I think one is a healthier and lives a healthy life if they incorporate yogic science in their lifestyle. And when there is a acute problem, or when there is a physical manifestation of a disease, then try to combine the two in a positive way. But don't mix it, but combine. There is a difference between mixology and understanding and incorporating, because they are two different ways, and don't mix it, because sometimes they might be opposite to each other, and you can do more harm. And this is where you need people who are expert. And this is, you should not do it on your own. You should have your doctor who is advising you on this, and hopefully the doctor also working with a complementary person who understands the yogic science, and these people have to work together. I notice in India there is a movement of training people in both what they call integrative thinking, integrative medicine. And I think, as you could see at the back of that folder, we have this Canada India Network Society, and this is what we are dedicating ourselves to. Integrative thinking, our big conference next year. The whole theme is how integrative thinking applies to your health. Okay, so now to your question of
Well, before we go to the question, I wanted to understand when you say mix, don't mix two things. Can you make it more clear for the viewers also to understand like what?
yeah. Okay. So I think uh, 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 Vedic yogic science is something you have to do yourself,
Hmm.
and that is takes a lot of practice and takes a lot of time. And essentially, it takes you at a stage where you are healthier, where you are able to cope through increase in immunity, and is very general. So it doesn't takes you into specific disease treatments and things like that. That is more you are as a person able to cope. So that's what I'm talking about in general terms. In terms of, so that and following that does no harm to you in any field.
Hmm.
But when it comes to specific treatments,
Hmm.
that you get a cancer,
Hmm.
and now I need to, I have no choice but to treat it,
Hmm.
which is very different than what I've been talking about yogic science,
Hmm.
right? So when you have to treat it, then you have different pathways to treat them. And one of them is Western science, which follows a certain pathway based on physical medicine. I'm not a practitioner of Ayurveda, so I would not even try to get there. But Ayurveda has its own science of treatment and interventions. And that's what I was saying, that one should not try to mix that treatment part with Ayurveda or with physical medicine. I personally believe that we will be healthier and we go long ways if we, first of all, self realize ourselves and have a healthy life,
Correct.
and then use the best of treatment available.
Yeah.
And it is, as I said, I'm not a practitioner of Ayurveda, but that science of Ayurveda itself is very well developed. The problem is how to find a
Correct.
qualified practitioner, and because it has happened over the years, the standardization, the accreditation. For example, I have seen even in Canada here people taking some Ayurvedic preparations which have been contaminated with heavy metals
Hmm.
in their growth. And so there are a lot of issues there, but that's a big topic. And all I would say for our conversation is that don't mix the acute treatment of the two.
Correct. I think I've also experienced both the things, where in my family also someone had cancer and then she had breast cancer. Then we obviously she had to go through the whole treatment of chemo. But after recovery, we got into that yogic practice because it was important for that also. And how these
Perfect.
plays well. And again, I want to repeat, I know yoga has become the thing, but we don't understand from where we are starting.
Yeah.
We always wait
Uh,
for that thing to happen, and then we like, now we'll start doing it. So
yeah.
it should be actually a reverse.
Wonderful. And I think just to re-emphasize that point, because if people don't get anything, they will get this point. This is where I say both fusion of the both.
Hmm.
So one is if suppose you went for Western treatment of acute illness, you still need a lot of support, emotional support, family support, your own self-confidence that this treatment is working and I'll be healthy. There is no substitute of that but yogic science.
Exactly.
And even here, we have acute treatment facilities, but we have community organizations which support the patient emotionally, spiritually, mentally, and physically. This is where principles of yogic science are very applicable. And the only thing I would add to that is in my journey, I have found they are applicable only if culturally you feel you're close to that. So that part of knowledge is very cultural based. So I think it will not be for everybody. You have to see what the culture is, where you come from, and then act accordingly. And it's very individual and it's very precise. So I think that is the fine nuance of culturally effective yogic science.
Yeah, I think a lot of in with culture, I think we also talk about where you come from as a surrounding that you belong to, because actually yoga is very wide. I can also keep talking about it, but the only beauty is that you need to understand how unique it is for you, from where you come, your background, what kind of lifestyle you live, all those becomes like a part of your culture.
Yeah, absolutely. Because yogic science, and that's why it's science, really emphasize the notion of time, the context, the space, and it's very integrated and very holistic. And I think you cannot take that out.
The
And I hope that conversations like ours add value to people's understanding.
Truly, and every year, like I think, as we are also evolving, even the science is evolving, yogic practice and medical science. So, though we call it ancient, but it's also because now we have different challenges, like COVID came in, the other things which are coming up. But the fact is that even yogic science is also penetrating into understanding like how to evolve and help people.
Absolutely.
I think that's one thing very unique that you're doing is combining two things, because some people are very against one of the things, but here we're trying to bring both of them together and make you understand at the challenging time that we are in. These two things will support us as when we say health.
Absolutely. And I am very sensitive that when you're trying, and I've done all my life connecting the dots, and I'm very comfortable with it, but it's also very challenging. Because
Right.
the easiest thing is for people to take a dogmatic approach and say, my way is the best way, and others don't work. And more reductive you are, more fundamentalist you are. But I have a message that you get better when you fuse things. And I think your health will be better in the right context for the right people using yogic science for lifestyle, using yogic science for health promotion, illness prevention, and chronic disease management for the support part, using Western medicine for precise diagnosis, intervention, treatment of acute therapy.
Very, very true. This is like it's something that we are also becoming, we are also changing with time, but we are also understanding that both are important. Our own culture, that's
For the right people using yogic science for lifestyle, using yogic science for health promotion, illness prevention, and chronic disease management for the support part, using Western medicine for precise diagnosis, intervention, treatment of acute therapy.
Very, very true. This is like it's something that we are also becoming, we are also changing with time, but we are also understanding that both are important. Our own culture, that's this, and the other.
Yeah, and a lot more research needed, a lot more conversation needed, and it's a ongoing. It's a destiny. It's a destination. Like, sorry, it's a journey. Uh,
Journey.
it's not like you have arrived, you know?
Very true.
Uh,
So going on to now women's health, why I am very specific about it is because I think we also hold the future of our own country because we give birth to new generation. And there where it became to my notice, like right now when I see young girls experiencing like at a very early age, they get diabetes and sugar at very, very early age. And also the cycle has now changed and now women are getting to perimenopause very early, menopause, so it's quite alarming and people take it very lightly nowadays. But the question I wanted to understand is that where do you see specifically on women's health? Now, as I again asked you this question, that what do you see, what has been involved, both medical science and the other side, and what do you think that is still we need to work on? Like, what is that area which is not being taken care
yeah, that's a topic in itself, and maybe we could do another podcast on it,
of?
having set the scene, you know. As a matter of fact, I think we should do a series of these because these are deep questions, you know. So, first of all, let me acknowledge that identifying the problem that Western medicine, the evolution of that, recognizes itself that it has been missing in their journey incorporating the diversity. So, a lot of knowledge evolved around certain cohorts, and most of it was very male dominated. So there is lack of data, lack of information, lack of reason, causality why maybe is affecting certain sectors, not only women, but people of different ethnicity and all this, because each one is individual. So I recognize and I acknowledge that we have a problem, and women's health over the last several years has become highlighted because now people are paying attention to women's health. So, for example, heart attack in women, the
Hmm.
symptoms women feel or heart attack are very different than men. The acuteness and the description of chest pain is very different in women than in men. So a lot of women heart attack are undiagnosed because people are still have this symptom as they learn in medical school what heart attack is. So they get missed, you know. And I think what's happening is that our awareness is increasing. Then we are clearly seeing that the prevalence or presence of these diseases is as much in women as in men. And women by nature are nurturing and they want to look after others and they don't pay much attention to their own self. So then that gets delayed. And then obviously the climate. Having said all this, I think there is evidence that because of environment we live in, because of context of time, because lifestyles are changing, that is having an impact on women health in more than one way, you know, because I think in not that long ago, uh, women were more staying in the home and nurturing people. Now they are still doing that, but then also they're also working. So there is that added stress, and I think one has to choose what works for them. But I think an answer to your question, my own feeling also is that the incident of new diseases is rising, and some of those diseases are rising proportionately or disproportionately higher in women than in men. And the hormonal issues and the reproductive issues and metabolic issues um, are getting a higher preponderance. And the other thing is, as science is getting better, we understand the mechanistics part of it better. So we're getting related to that. For example, polycystic ovarian syndrome now getting more understood as a metabolic disorder rather than a gynecological disorder. So I think with all that understanding, it feels that we are increasing the burden of disease among women.
We also need to also understand like obviously now as a women, yeah, I'm also an entrepreneur, so there's a lot of things that we are also working on, but we tend to forget and keep ourselves behind, like we look
Yeah, and I think
ever.
I've written some op-eds on it, and I think we need to make a extra effort to be inclusive and increase the opportunity for women to be early diagnosed, early investigated. Prevention is better than the cure, and whether it's cancer, whether it's metabolic diseases, whether it's cardiovascular diseases, I think it's sufficient to say that their prevalence is pan-human. Both men and women have it. It's just the symptoms are different. And in the past, they might not have been diagnosed or ignored, or part of it might be women themselves because they're so nurturing that, oh, I want to take care of you, but in process, not myself.
Very true. As I was reading this book on You Can Heal Yourself, I was also reading that how these, we tend to have um, firstly, we are nurturing, so we tend to ignore and we try to hold those emotions inside.
Yeah,
Body starts keeping the score. It starts, it starts getting affected because you're suppressing those emotions. And we actually, being also coming from an Indian background, we always had that it's never me first, and it was always be either my husband or my father,
yeah,
brother, and then in a way, in that process, you're also holding up on your own feelings and emotion, and therefore you also see the effect of it on your body, like thyroid and all has become very common. Diabetes has become very, very common. I was surprised to see that, my own niece at a very early age, she had diabetes, and that was like very rare.
yeah, absolutely. And they were always there, but it's just not recognized. And this cultural aspect is so deep, and it gets part of your DNA that you feel guilty if you're not doing that. And it's expected. And if you don't follow that expectation, then there is tension in the family and there is a tension in the society. And I think those are the things we need to overcome and say that everyone has the right to be healthy. And my message to everyone is you cannot take care of somebody unless you have taken care of yourself.
Right.
It's a myth that I can continue, but then it's harboring inside the anger and the anxiety. And I think what's happening is that in modern era, all that is coming out, and that also creating different interactions in society, and we need to recognize that. But our messages, I mean, that should not be lost. That you have to take care of yourself. You have to get diagnosed or get a screen or study so you are healthy. Part of it is your own personal health, lifestyle, eat well, sleep well, exercise, and stress, and all those things. And we could have a whole discussion on that. But importantly, there are certain things which modern medicine has brought out which should be followed. So the screening for cancer, I think, is a must.
Mhm.
When you have chest pain or discomfort, that should be investigated.
True.
When lifestyle and obesity and food becomes very important, and we need to make sure that we're eating right, we're eating at the right time, we're eating the right amount, we're eating the right way, we are eating the right food, that will go a long ways.
Yeah, very true. I think those four pillars that even yoga practice also says that your ahar, what you eat, you should always nourish what you're eating and from the place that you're getting uh,
Yeah.
belong. And then vihar is, your basic routine that you have, and which are your thoughts that you adapt every day, what kind of thoughts you're and what kind of surroundings you are with, and which are is like giving yourself that time to break from the routine and doing something that really nourishes you. So I think those four pillars are something I keep repeating it, and also it's a learning for me, also a reminder for me also. But my second question is in relation to, I'm a yoga teacher and I work very closely with a lot of pregnant women. And I believe that
Sorry, work with, sir, work
a
with?
lot of pregnant women and new
Oh
mothers.
yeah, 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 yeah.
So, as I was reading in Garb Sanskar, and how important it is, the power of movement and breath during pregnancy, and how all these also nourishes the pattern of your baby. So, I was also reading recently, there's a research which says that when you get diabetes, gestational diabetes, there are more chances that your child also gets, because the insulin level increases in your body. Now that affects your baby's, the baby becomes bigger than usual. Correct me if I'm wrong. And so I was reading the research that it does affect your child. So not currently, but later on, that kid will have diabetes, or like for example, thyroid also. Give myself an example because my mom had thyroid, and I later on it came naturally as a DNA to me also. So that is what I wanted to understand. How do we see, again, medical science and yogic practice? What do you think that will help women during pregnancy? What all they should work on and what all they should do to take care, especially in that phase?
Yeah, well, it's a very very deep question, and I appreciate the complexity of the question. And uh, there is a lot of traditional wisdom which already exists in when you're pregnant, what you should do. There are some myths around it which needs to be dispelled, but certainly in 2025, it's clear that movement or exercise and making sure that you are making sure of all your bones and muscles and body, whether you're pregnant or you're not pregnant, is very relevant.
Hmm.
So I think the and this is where yoga comes very beautiful, because yoga allows you to to teeter the level of intensity according to your need.
Hmm.
And I think during pregnancy, the intensity is not the same as non-pregnant, whether female or male. And if a 6 foot muscular guy and intensity there compared to me 5'7", not so muscular, is very different. And you are the judge of that. So I think I would say, in answer to your question, yes, to all those things you have raised are needed, and women during pregnancy should be, first of all, monitored and assessed on a physical body part. Is very important. What is your blood pressure doing? What your urine analysis is? Whether you are, how's your glucose level, and all those things. And gestational diabetes you raised is a huge topic.
Yeah.
And I think prevention is very critical, and lifestyle plays a huge role. And the other thing is gestational diabetes and diabetes of any type in Indian context is very much related to food we eat and the amount of simple sugar, white sugar we consume. So I think prevention of diabetes goes long before you become pregnant. Right from early childhood, you need to cut down on those jalebis and rasgullas and gulab jamuns, and that's a no-no. If there is, I don't prescribe much in terms of diet restrictions. My only restriction is simple sugars, simple soluble sugar. So no added sugar in your coffee, tea, and chai, and all those things. But one thing is me saying, one thing is people doing, the amount of consumption, because it's addicting. The sugar is so addicting, your body requiring it, and you just want. And in pregnancy, that is a huge problem. And so you need to get screened for diabetes very early. They say 23 weeks and 24 weeks you need to have the test. And your question about gestational diabetes and long-term implications, if you are gestational diabetes, that by definition means that you were not diabetic before you got pregnant and you become diabetic during pregnancy, and chances of women becoming diabetic who are gestational diabetic is very high. So that means they have to take extra care of all the things we talked about after pregnancy, and chances of baby getting diabetes is high if mother was gestational high, and it's a combination of epigenetics and genetics, so there is a fair amount of science there. So I think in short, message is yes, lifestyle is very important, and gestational diabetes is a major issue everywhere in the world, but especially in India. And a lot of it is related to what we've been consuming, that high proportion of carbohydrates in our diet for long, long time, long before we became pregnant. And Priyanka ji, the sad part is that majority of it is being done because people are not aware of that there is a relationship, there is a causal relationship of what you eat is what it pays for itself. The old karmic philosophy.
Yeah, I think there are a lot of people, especially when I interact with women, they always say, "Oh, my grandmother used to eat all that. How come I have?" So I always tell them that, your grandmother had a very different lifestyle. Like our grandmothers had they would do a lot of things at home. Like they will walk a lot, they will sit in malasan for longer time. They were Indian toilets, not Western. So I know we are also becoming modern and we have a lot of facility and comfort, but also comfort is making us adapt these habits of you know
Yeah, Priyanka ji, that's a very good question. And I think if people don't remember anything from this, they need to remember that those myths that my grandmother did has to be taken into account in the terms of what yogic science says, the time and the context. And the case in point is sugar.
very true.
Never in Indian history, sugar was as widely available as it is post-industrial.
Very true.
In the grandmother's time, sugar was a precious element. Sugar was very expensive, and it only came in the form of honey. And honey was precious and used in drops.
Mm.
And now, with the post-industrial civilization, sugarcane and availability of sugar and addiction, and the curve clearly shows diabetes going at this level goes up higher. So I think people need to put that in context. I don't think there were that many jalebi shops and rasgulla shops in person's grandmother's time as it is now. And this is a myth which has to be clarified and really understood.
Very true, because this is an argument which all of us give, and this is a very good example of. I was also reading about this research that at their time sugar was very, and it was like very very scant, like it was very difficult to get. Only the rich people would get sugar, and that also was used in very minimum amount. Now,
Yeah,
as we also
and
increased, and also because of the carbs that we're having. So we always say, oh, our Indian diet, but also we don't understand how our Indian diet was and how much we should and what all we
yeah,
should include in it and not include. It's a huge topic itself. But
yeah, absolutely. And I think clearly Indian food is one of the most healthy sattvic food. And yogic science talks as a matter of fact, the whole yogic science is based on lifestyle,
Yeah.
and food is a big part of it. But we need to understand what that food is. And Indian science, yogic science, clearly stipulates not only what you eat, but when you eat,
And how
how you eat, how much you eat, and why you eat.
are you
And
eating?
people forget those things. So everything has to be taken in the context and time and space.
Right.
And don't look for West to provide answers. Uh, the wisdom, and so I think if there's nothing out of our this show, Indian food is one of the healthiest food in the world. And we don't need to go around chasing ketogenic diet, this diet, that diet, and stay with the basics of Indian food. But understand what you're eating, why you're eating, how much you're eating. And the only big change which has to be made is availability of simple sugar
Yeah.
and reducing that sugar in any form. And obviously adding sugar in your tea and coffee and chai, but syrupy stuff. So I was born in Agra. Agra is the capital of Petha. And have you seen those syrups they have? And the amount of insulin it produces? Priyanka ji, when you add 1 teaspoon of sugar in your coffee, 1 teaspoon is four grams of sugar, and that is equivalent to what is circulating at any given time in your body. Just imagine you're loading your body instantaneously with that rapidly absorbing sugar, and your body has to respond. So then now pancreas gets into the shape, and insulin starts to come out. So I think it's very simple, but just people don't connect.
Yeah, yeah, we just want to, we love complicating things, but I think the way we see now, things are evolving, people are becoming aware, but making it as a practice is becoming difficult for them. So always tell them take small step, because I've also practiced coming from one person who loves sweet, because I also have a background from Agra, so we would love sweets after every meal. But then I realized like how slowly when I started cutting down, it's difficult in the initial stage, but you replace them with either khajur or you replace it with gourd, and then slowly cut down, and it naturally starts happening because
Yeah,
the
and
body.
yeah, absolutely. And I think it's the amount. So you just have to take a little bit, that's fine. And you understand in total proportion. You understand good understanding of carbohydrates, fat, and proteins in the meal. But that's a topic in another direction, except to end on the positive note, I go to India. We have this Canada India Network Society, and I have seen a big change in Indian psyche in last 15 years. I was talking like this 15 years ago, and people were rolling their eyes. Now, when I was there just in April and I was there in January, a big change. And I think a lot of it's to do with the leadership. The awareness is there, and people want to be healthy, and they are looking at themselves and their lifestyle as one of the factors which was not there before. And people like you are coming forward, young people, and they are saying, let's be healthy, and we need more of that. So thank you very much for your initiative and your work. We need more of that, and in any way we could help, and certainly I'm very passionate about it.
Totally. I think it's thanks to you taking out that time. And I have so many questions, but before we get into the other one, I just wanted to ask you, as you know, that a lot of hormone imbalance is often now manifested through anxiety. Women are getting very anxious, and that becomes like a hormonal changes that we say PCOD, PCOS is becoming very common now. And actually, now every third woman has and infertility. So it is. I feel that it's manifest through your thoughts of your anxiety, stress, insomnia because you're not sleeping properly. While all these are there, what do you think women can like? What are the lifestyle principles women can adapt early to prevent these long issues? Obviously, yoga practice is there, but what does the medical science help us? Like, how does it help us in that?
Well, you're asking some very, very critical questions. Again, I will answer by saying we need to have the best of the East and best of the West.
Hmm.
So any time when body manifests itself with certain things which are not functioning properly, you have to first understand why.
Hmm.
So issue like diabetes or infertility in this case, one has to make sure that there are not obvious reasons where physical body, which we talked about, has some blockage or some reason. So if you are having problems in uh, uh, conceiving, you must get investigated and establish that there is no obvious organic reason that that's happening.
Hmm.
You cannot uh, you cannot uh, underestimate that. And in the case of fertility, it's both men and women who have to be investigated because it takes two to tango. And you could blame all on woman or say woman is there, but cause might be somewhere else, right? So that has to be understood.
Totally.
The point you're raising is what are some other extra physical reasons where we are seeing some of the manifestation uh, of diseases, or if you want to call infertility a disease, it's not a disease, but just the way it presents itself, right?
I'd say
And this is
hormonal imbalance. We'll not call it disease.
yeah. This is where psychosocial environment and social determinants of health do play a role.
Hmm.
So, in the terms of context, stress, terms of context, sleep patterns, terms of context, financial stability, financial health, economic health, social health, spiritual health, and what the situation in the family is. All those do play a role because uh, because uh, in the physical body, conception and sperm and ova coming together and forming a child is a very complicated process.
Hmm.
And there are so many factors, including hormones, and they all can misbehave. So I think it's very important that all those factors comes in. And yes, that plays a role. And I think environment is playing a role. Toxin in the environment is playing a role. And as women are more and more in workforce, their cycles are changing, their hormonal patterns are changing, their sleeping patterns are changing, and all that does play a role in infertility, or for that matter, for any manifestation of diseases. It's too big a topic to talk just in few seconds, and but I think to just recognize that go back to the basics. Don't worry about the complexities. First is make sure you take good care of your health, get a good physical examination, get a good thorough examination, which then analyze on the basis of most up-to-date modern science that your physical body is working properly.
Hmm.
Then have a lifestyle which is a balance, which is harmonious, eat properly, sleep properly. I mean, simple things, but very hard to do.
Yeah.
Very hard to
Movement
do.
is something we all lacking.
Yeah. And the four pillars, uh, food, exercise, stress, and mental emotions are very critical in this picture.
Very true. Uh, Going forward, I have the last question before we end. Like, now, do you think the future should be, as we talk about two things merging together, not merging, but two things parallelly working? Do you think now yoga teachers or yoga practitioners should be also a part of a doctor's When a doctor is diagnosing something, I think I just feel that's my own belief in it that even a yoga practitioner should be a part of where you are treating a patient. For example, someone has if right now I talk about pregnancy. If someone is pregnant, do you think that the yoga teacher and the doctors should work together as a team to help this person during the pregnancy phase? Because or irrespective of pregnancy, any other infertility or other issues are, because this is where I feel the future should go in relation to like medical science and the holistic yoga practice going together. Because I realize that the doctor says something and the teacher is saying like there's no connection. So do you see
Yeah,
a
absolutely, absolutely. I mean, the fundamental nature of Vedic science is that right hand should talk to the left hand, the fusion, the integration. That is the fundamental integrative thinking, thinking of the system as a whole. That given, and I think that must be done. Now, your question, how it be done, uh, has to be it depends on where you are, what the facilities are. And I think it's important that somebody who is advising you about your health, and whether it's a doctor, and whether it's your grandmother, or whether it's a yoga teacher, or whether it's a physiotherapist, they all need to be in sync. They need to be working together. But given the human dynamics and given the human complexity, how do you bring it together?
yeah.
And I think that, thank you for asking that question, because that's what the main mission of my organization, Canada India Network Society, is how to do that in that context and do it with a proven concept. Sometimes it's better to make sure that they are connected, but they are not in each other's way. So, general practitioner or a medical practitioner have a certain ways of doing things,
Hmm.
and they need to have the freedom, and they need to feel that they are doing their thing. But how do you get the other style advice on lifestyle, and how the intervention on the lifestyle plays? In Canada, at least with our own organization, we are running some ideas of building community capacity in prevention and health promotion. And that's what you're talking about, how to do it. And what are the players who could play a role in it?
Yeah,
I would start with family. Family plays a huge role.
true.
And the good old grandmother you talked about earlier is missing in the picture. They're the best advice which has to be had it. So family plays a role. The role of philosophy and the religion and the priest, because they play a huge role because of our faith system.
Hmm.
And I think their advice is very important. The advice of the doctor is critical because people look up to them and they have expertise. But their expertise is limited to this physical medicine. But then it's the individual themselves. How does the individual plays a role in their own health? And how do you provide facilities so that they are motivated? They want to do it. And my own view is the best way to organize this based on our 15 years of research is in capacity building where like-minded people come together, and yoga experts, nutritional experts, diabetes experts, even the doctors come and share with them the knowledge. But the heavy lifting is done by the people. So,
Yeah.
for example, in your setting, will be ideal to have, we have clubs, we have health clubs, we have community centers that for pregnant women, if there was a place where they could go
Hmm.
and share this, and this knowledge is available, and this is where yoga classes can be held, this is where yoga teachers can be held, but they need to work in sync with the doctor. It cannot be isolated. Doctor knows what is being taught there, and this group knows what doctor has said for the medical reasons, because everything you do has a impact. Everything you do is interrelated. Sometimes you shouldn't be doing certain yogic exercises because of your health, and that all has to be there. So they have to work together, but how you organize totally depends on the local situation. Maybe the day is not too far. Maybe India could take a lead, what you call multidisciplinary one shop place. So there is a clinic, the doctor is there, a yoga practitioner is there, pharmacist is there, dietitian is there, and they support you as needed in symphony. So it's like I would like to end with a visual like a symphony. So, when you go to listen to the music, there are 70 people in the orchestra. And if they weren't in symphony, just a noise will come. But with the conductor in place, that different instruments become very sonorous, very, very musical. And I think that's what you're talking about, is a symphony of different players coming together with the idea of bringing music.
Truly, truly. This is what I think I see as a future also, because this is what we are right now lacking, because we are working very individually, which I feel that
Yeah.
individually we are trying to do our best, but we're not understanding that how we can also collectively do something which will be more supportive. And I think also the awareness about all this is very important, and that is the reason we did it podcast is also because I want to make women more aware of what is where they are and how they can don't ignore these things, also become aware of even in pregnancy. It's okay, spend time on yourself, on your health. What does health mean to you also, and what are the what all you need to be red alerts that you need to flags, red flags, you need to name them and work on it instead of just keeping it as
Yeah, absolutely. And I think from a practical point of view, maybe is the community. So corporations or employing agencies could recognize that it's important for their employees, and they could create this facility and where this kind of thing is provided, and then people will see the benefit.
yeah, yeah.
uh, we cannot just depend on government to be doing everything, and we need to do it ourselves. Some in India, I know housing is through these societies where society is formed and they create a building, and that building can provide this medium. They could provide that facility as an organization. Um, in India, there is a very strong family values, so the families can get together and provide that. So there has to be that idea that we are all in it together. We have done fair number of round tables, and every table has told us what need to be done. And the issue is that there is no cookie cutter and there is no one model. You need to make it happen according to the local need.
Yeah.
So some people like to have their own community doing it. Some people want to do it in a temple. Some people want to do it in an old folks' home. Some people want to do it at a place of work. Some people want to do it through a doctor's office. So I think one has to have a common pathways, but different places where it's delivered.
Well, I think now, as we see the scenario also, I think workplace should be one place where, like these MNCs and corporates, I work with a lot of corporates, and I realize that you need to give that because you're spending maximum time in office. So you need to give your employees that 1 hour of these wellness experiences where you are making them aware. In relation to pregnancy, also, I always, I'm trying to bring this awareness to everyone that at work also there's certain things that you can do and make it as a thing like 1 hour of every week. The corporates would be of a great, like they can start making this as a practice, which not only help their employees and especially pregnant women, because I get a lot of pregnant women complaining that after their delivery they don't have jobs now or they're struggling with something. So we're trying to make that women can go back to work, but you also need to provide them with that space and energy where they can take care of themselves and their offsprings.
Absolutely. I think that is on that positive note. that there is a solution, there is a wisdom here, and a balanced life, balanced living, and a balanced food and balanced exercise. Everything in balance is really the motto of yogic science. An application of yogic science in modern life combined with most modern scientific modalities which have come out of the West, I think is the way to go. So thank you very much, Priyanka ji.
Thank you, Dr. Arun, for your time and for sharing all these insights with us because they're two different worlds which we are trying to bring together, and which is very important also. I never used to believe in medical science a lot, but now I've started understanding that there is, this is also relevant and also the yogic practice. So yeah, that's the beauty of both of them. And I'm so glad that today we could make this happen. And there are more and more discussions. Like I have too many questions now.
Yeah, well, I think we could. I'm very happy to participate with you and do this on a regular basis. We could even create a series of them. And having said now the scene, we could have very specific topics, so we could take sleep and one with a woman's perspective. We could take infertility. We could take diabetes, the themes,
Yeah,
and work on those. I think more knowledge is shared, more awareness is made, is better. So ours is just a small attempt in that big picture.
very, very true. Very true.
Okay.
Okay. Thank you. I will see
Thank you very much.